Welcome to our latest episode of the Lebanese Physicians Podcast. Today, we will be talking about a topic that is very important for me, which is hair loss, and for everyone else, for a lot of us too. The title of our podcast, Beyond Minoxidil, Exploring Alternative Therapies for Hair Loss. And our guest is Dr. William Abou Shahla, who is currently resident in Brandenburg in Germany, which is about 40 minutes away from Berlin. William, welcome to the podcast.
Thank you so much for the invitation, really, Dr. Khalil. It's a pleasure for me as a junior doctor to join your podcast.
No, of course,
Thank you.
100%. And you guys are the promising minds of the future. So we're getting older here.
Yo,
So,
thank you.
so can you tell me a bit about yourself and how you ended up in Germany in Brandenburg? Because also I think it's interesting for people because I think there is an increasing number of Lebanese medical graduates going to Germany, but
Yeah, for me, I studied medicine in Poland
yes,
and I moved from Poland to Germany. Then I went to Lebanon for an internship because in Europe, you do a full year internship. So after graduation, so I spent that year in Lebanon, rotating and also sneaking in part-time work, like with the two NGOs between Beirut and Bika. And then I joined the Department of Dermatology at the American University of Beirut as a research fellow. And after that, or while being in Lebanon, I was preparing for the language because the residency in Germany is in German. And then I moved here last year for the residency.
that's great. And already, I think you've published a nice review, actually, article discussing alternate therapies for hair loss, stem cells, oils, and laser treatment. And that's part of the reason I invited you today to discuss this very important topic that a lot of people are interested in.
Yeah. Okay.
So, what led you, I guess, to explore alternative therapies for hair loss in your clinical practice?
Like in my experience, every good project starts with a real life question we can't answer yet. So in our case, we were seeing the same one over and over. So while I was shadowing and recruiting patients, even for other projects, this question pops up like, do these alternative hair loss treatment I saw on social media like actually work? And I will admit I'm personally as well invested, like I have androgenetic alopecia. And when I see a dermatologist, I want an objective, fact-based answers, like not wishful thinking. So we did already studied how TikTok can fuel steroid misuse and withdrawal, and how sunscreen, that's another project, habits, for example, improve when the message comes from a dermatologist rather than a random account. So we knew the stakes, that misinformation spreads fast and patients listen to the loudest voice. That's why we decided to review the data on alternatives to bring clarity instead of just throwing opinions. And you can feel nowadays this momentum at meetings too. Like for the past few years, in international dermatology congresses that I attended, and also in the Lebanese Dermatology Congress, you see a whole session dedicated to myth busting, if you want. So it's become more like a part of our job description. So the project came from patients' need, my own curiosity, and commitment to cut through the noise with actual data. And hair loss has a major impact on patients' quality of life. And many of them come to the clinic looking for solutions beyond standard medical or surgical options. I noticed that a large number were already experimenting with oils, supplements, or devices they found online. And that gap between what patients were seeking and what we could confidentially recommend motivated me to review the evidence on alternative treatment. And our goal was to critically assess which of these newer therapies, like stem cells, natural oils, and low-level laser therapy, actually have scientific support and could be integrated into clinical practice.
Yes, and that's a very interesting thing because in my mind, like whenever I think about hair loss, I'm losing my hair too, and I always think about that there's no significantly effective therapies at this time for hair loss. And then you see a lot, as you said, there's a lot of myth that come about online that people keep trying. What are some of the most common myths that you have encountered? What are the current approved treatments for hair loss?
Traditional treatment like minoxidil, finasteride, and hair transplantation remain the backbone of therapy because they are well studied and effective for many patients. But they don't work for everyone, and some patients either can't tolerate them or prefer less invasive approach. So that's where alternative options come in. Like they can complement an established therapy and offer choices for patients who are reluctant to use medication and may even open new doors in regenerative medicine. So I see them not as replacement, of course, these therapies, but as potentially valuable addition to the treatment toolkit that we already have.
So how effective is minoxidil in preventing hair loss?
Minoxidil is till now is the go-to therapy to prevent hair loss, and even after losing some hair, going in minoxidil for months can really help, like in using it in everyday life. But the thing is with the compliance, like patients don't comply to minoxidil because they don't see effect in 1 or 2 months, like after 6 months or so. So patients tend to give up on treating themselves with minoxidil.
And the other one I think that I see a lot of my friends have done is go to Turkey and do hair transplantation, and
Medication,
very effective therapy, right, for a lot of people.
exactly. Yeah.
Okay. And so who are the people who I guess do not respond to these therapies like minoxidil or hair transplantation? Is there a certain profile of people who do not respond to these therapies, or it's sort of a trial and error thing and you see if you respond or not?
One of them that we saw in our actual review is the compliant to therapy, to minoxidil for long time, for long term. And of course, when it comes to some patients that they lose their complete hair after a certain amount of time, like starting when they lose the hair follicle, starting over minoxidil won't help, so they go to transplantation. And this review mainly discuss the non-traditional treatment that can potentially help later on. So
Yeah, I wanted to get people to know what the traditional treatments are first and then go into the non-traditional.
like the traditional treatment, normally minoxidil, it can be in different forms like foam, spray, or so on. There is also systematic treatment, finasteride as well, and then hair transplantation. That's the last medical approved treatment for hair loss.
So before we go into traditional therapies, I'm going to ask you what are the most common causes or etiologies of hair loss?
The most common, the alopecia areata and androgenetic alopecia. It comes with patterns, male pattern and female patterns, and that's the most common, of course. And also we tested these, or in our review, we review only the non-traditional treatment to treat alopecia areata or androgenetic alopecia.
So can you, in layman's terms, can you describe what alopecia areata is and what androgenetic alopecia is?
Yeah, usually in alopecia areata, there's many forms of it. And in androgenetic alopecia, we say it more in the name, it's more genetic and it has a certain pattern. Like for male pattern, and you can see it in the middle of the scalp, for the female, more in the frontal side. So it's mainly genetically related. And it starts to show mainly after 20 years old or 25. And this is the mean average age of patient that we saw in clinic.
And basically, both of these entities, I guess, are basically based on a loss of hair follicles, right? So basically, when we look at alternate therapies, it's therapies that potentially can regenerate these hair follicles. So can you give us some of what you found in your review in terms of, let's start first maybe with stem cell therapy, because that's a big thing, not only in hair loss, but in other diseases. So how can you tell us about some of the stem cell-based treatments for hair loss and how do they work on the biological level?
Yeah, so the stem cells support hair growth mainly through fine signaling. So they release growth factors like VEGF and IGF-1 factor that improve blood supply and stimulate the dermal papilla cells, which are key regulators of the hair cycle. They also influence pathways like WNT beta catenin that drive follicles into the growth phase. So in some cases, the cells themselves can differentiate or promote regeneration in the scalp microenvironment. And the net effect is to prolong the anagen phase and increase hair density and thickness of the hair. So to answer your second question, what is the current evidence that supports stem cell? Like with adipose-derived stem cells, we have the strongest data actually. Across multiple randomized studies, a cellular product like adipose-derived stem cells, conditioned medium, and constituent extract improved the hair count, improved also the density and thickness within a few months. For example, there's a double-blind vehicle-controlled trial in androgenetic alopecia showed higher hair counts by week 8 and greater hair shafts diameter by week 16 with topical adipose-derived stem cell CE, which is the constituent extract. And another study using monthly intradermal adipose-derived stem cell increased both the anagen hair rate and the density over 6 months. And there's a systematic review actually also that we found, also found increased count and density versus placebo, but over 16 weeks. And there's also for cellular advanced derived stem cell, a small clinical series report shows the thicker subcutaneous tissue, improved thinning, and good patient satisfaction. That's encouraging, but still small number of case report. And there's also the another type of stem cells, which is the hair follicle stem cells. One clinical study showed about a 30% density increase versus less than 1% with the placebo. And there's another found similar improvement with the hair follicle stem cells were compared to bone marrow mononuclear cells in androgenetic alopecia and alopecia areata at 6 months. So bottom line, we're seeing real clinical signals, especially with adipose-derived stem cells derived product, but we still need standardized protocols and long-term studies, well-controlled trials before calling stem cell therapy a finished treatment. And we talked in our review also about exosome therapy, which is another exciting area.
Before we go there, ask you a question about the stem cells. So when you say adipose derived, that means they're derived from fat cells.
From fat, exactly, yeah.
And how does that work? Like when you derive them from fat to grow the hair follicles, and you just put them topically, how many times per day?
Yeah, it's mainly derived. There's also a human derived extracted from animal. And some of these adipose derived stem cells were actually either intradermal, like injected, or other studies.
Right. So on the skin, like put on
Yeah,
the
yeah, on the skin.
Okay, excellent. And now you can go to the exosomes. I guess that's the other one that we were going to discuss.
Yeah, it's another exciting area which is really important nowadays. And early case series show positive results, but studies are small and often lack control. So overall, we can say the data suggests benefit, but we need larger and standardized, maybe long-term trials before calling this treatment actual treatment for hair loss.
So can you describe to us like what are exosomes, just for the layperson? What are exosomes? Exosome treatment.
Yeah, exosome is part of those stem cell therapy, if I'm gonna say stem cell therapy. But some of them are adipose derived, others come from another type of material used for stimulating hair follicle growth. So exosome is one of those.
One of those. Okay, great. So basically, you can either inject or put the stem cells topically, or you can inject exosomes that are the ones that will stimulate the hair growth. So you can give either stimulating factors or give stem cells to grow the hair follicle from the get-go.
Exactly, yeah.
Okay. So then I think you talked also about natural oils and topical remedies. So a lot of times you hear, like we said before, you hear it on TikTok and you don't know, like you go to the store, I'm like, oh, let's buy whatever they said. Well, which natural oils or plant-derived remedies have shown the most promise in hair regrowth?
From what we reviewed, I keep coming back to a few, like the palmito, both oral and topical, showed reduced hair fall and a pump in density in a randomized placebo-controlled study. Another oil, the pumpkin seed oil, had visible regrowth signals in women with pattern hair loss. That's what we found. There's also an aromatherapy blend like thyme, rosemary, lavender, cedarwood, and carrot oil outperform carrier oil alone in alopecia areata with blinded assessment. Rosemary oil has encouraging animal data, while a systematic review didn't find solid hair growth evidence for other oils, like which are very famous on Instagram or social media, like the coconut, the castor, or argan. Despite hair care benefits, the systematic review didn't find solid hair growth evidence.
Okay, so basically the ones that have the most evidence behind them is saw palmito and pumpkin seed oil.
Yeah.
Right.
And rosemary oil, it showed a really encouraging animal data, but as I said, still more has to be done.
Would you recommend oils like standalone therapies or maybe as adjuncts to standard treatments that we discussed earlier, like minoxidil or
Definitely. Definitely not as a standalone.
yeah.
Definitely not. Like I frame oils as complements, like and definitely not replacement therapy. Like many dermatologists are comfortable letting patients continue them because the safety profile is generally favorable. But given the current data that we have recently that we had in our review, I usually pair oils alongside established options. And one safety note from our review that to avoid applying certain oils to infant, like the peppermint. It's peppermint were also booming on social media, but these can cause apnea or reflex apnea in young patient or infants. So using it as a standalone is not a good therapy, of course.
What we're saying is be aware of social media, always look at the evidence and don't just watch TikTok and then use whatever they tell you.
Exactly.
Then the question is how much oil is enough?
This is a very interesting question that we didn't look at actually, like how to apply these oils and how frequent should they use it and so on. But I assume it's like minoxidil, it could be sprayed like the hair,
Yeah.
but definitely not dipping the hair, like in that sense.
Uh, so the other therapy that was interesting too is low level laser therapy. But what I know about laser therapy, like a lot of ladies, let's say, or women go do laser therapy to prevent actually hair growth, right? But here we're using it to stimulate hair growth. So what is the data on this and how does it work to stimulate hair growth in this case?
Yeah, to keep it simple here with laser therapy, the light is a nudge that pushes actually follicles back into growth mode. So in our review, we found it activates the WNT beta-catenin pathway, sparks gentle redox signal after chromophore absorption, and boosts also the mitochondrial ATP production in follicle cell. But together, that means like longer anagen phase and a delay in catagen. So we will have more growing hair and fewer resting ones, if you want.
So yeah, basically it stimulates, I guess it takes back so it's basically maybe a different wavelength than what is used to, let's say, prevent the hair follicle from leading to hair growth, right? Are there particular patient populations or types of hair loss that respond better to low-level laser therapy compared to others?
Most of the evidence reviewed is in men and women with androgenetic alopecia. Devices can be less effective if hair is long, if the hair is thick or dark. That means less light reaches the scalp, and cohorts with a darker skin phototype or a more severe alopecia sometimes show different outcome across study. Also, as an adjuvant after hair transplantation, this laser has been reported to shorten recovery and improve graft survival
Okay.
after transplantation.
Basically, maybe similar to the oils, it's probably not a standalone therapy, but could be an adjunct to some of the standard therapies with hair transplant that we use for these patients.
Exactly. Yeah.
It probably has limited efficacy because probably you need to stimulate a lot of hair follicles to get a good result. All right. So now, any other therapies that you guys looked at? And at the same time, any therapies that are myths out there that you would tell people to avoid doing? Because I've seen some people, once I saw somebody tell me, I think they do something with like blood, like you stick your scalp with and then you grow the
Be like rich plasma.
yeah, 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 that's it.
It's very effective as well. And also, it depends from patients to patient, like who will benefit the most out of it. But the thing is, in our study, we concentrated more on trend more than actual treatment because, like, when you come back to PRP or rich plasma, it's more biologic from our blood, and we're using it for stimulating hair follicle growth. But like for these trends on Instagram, like these laser therapy or oils, or these were we were interested in these more in our study.
Yep. And so, I mean, we've discussed, I think, a lot of therapies at this point, but let's say you get a patient coming to you and telling you, a middle age, let's say 30 years old, telling you, I feel like I'm starting to lose hair on the frontal part of my scalp. And I have a genetic tendency. My dad had the same thing. What is your recommendation to treat them at this point?
At first is always to go to the medically approved and FDA approved treatment. It means minoxidil, hair transplantation when a case is very advanced and compliant to treatment is impossible. And if I'm gonna apply also what I learned from what I studied in this or the result of this study, like first, I recommend that the patient ask always about the evidence, about the safety, and about if the treatment fit them or not. So this is very important. And by that, by the evidence, I mean like patients should ask, like, should show me the actual data. Like, is there a control, a randomized control study? What outcome improved? Like, does this treatment improve my hair density rather than just showing me photo before and after? And in our review, some oils had signals in randomized setting. Laser had mixed, but really trial and are missing. And the stem cell-based product are early stage with variability. So that's mainly about the evidence. And then, of course, the safety is another major topic, like who's making it and how. Are there clear protocol, like as you asked me now, how can I apply the oil, like the dose, the frequency, the device settings, and is there any known side effect to that? This is also an important question. And the third one that I recommend the patient also to see is, does this treatment fit me or not? Does it match your diagnosis and lifestyle? Most evidence centers on androgenetic alopecia. Results can vary with hair, skin characteristics, and adherence as well. So if a device or a product doesn't come with a clear plan, I think about wavelength, dose, schedule for the laser therapy, then that's a red flag. And always, like, again, there's a checklist. Like, is there a peer-reviewed study and what did it measure? This is about the evidence, about the protocol. How do I use it? About dose, frequency, duration, and what are the known risks? This is very important. And if we see no objective improvement by certain X weeks, what's the plan B? So anything, if it has published outcome, a clear instruction, and a reasonable safety story, we can try it. If it's mostly marketing, then we pass.
Right, right. And yeah, exactly. So go to a potentially specialist to do this rather than watch TikTok or go to some of these centers that pop up everywhere that may not be licensed or might just be using the
Yeah,
procedure to make money, right?
and some might see the trend on TikTok and try it while trying another therapy like minoxidil, and they will associate the benefit they get to the rosemary oil or to the other oil they use with the actual treatment. So what I'm trying to say is that if you want to try something else, a complement or oil or an alternative therapy with minoxidil, try one at once and then see there's no harm in stopping 3 months when you see no effect, and then we do another alternative.
and make sure this therapy that you're trying is not harmful to you, as we discussed, like for infants, right? So,
Exactly.
yeah. So, in your opinion, what does the future hold for hair restoration? And will we see more integration of regenerative medicine and technology into this field?
Yes, of course, if it's done rigorously, like for devices like laser, the signal is there, but we need standardized parameters and long-term follow-up. On the biologics side, progress depends on quality and consistency. The field called for large, well-controlled trial and long-term monitoring. I'm also excited by directions. Our review highlights extracellular vesicles as a potential safer alternative therapy, but the result of the review is calling for more RCTs to support these trends and alternative therapy.
In summary, I think, William, this was a great podcast, and I think we were able to discuss the standard therapies that are still probably the standard of care right now, which are minoxidil, finasteride, and hair transplantation. The alternate therapies seems like there is alternate therapies that are coming out that are promising, but still we need more high-level data to show that they're effective. At this point, you may be able to use them as an adjunctive treatment to the
That
standard therapies that we use.
And I hope more RCTs will be published soon, certainly regarding the stem cells and the exosomes that can potentially be an FDA-approved treatment side with minoxidil and the other treatment.
Yeah. Thank you so much for being on the podcast. And I think I've learned a lot from you. I might open up my own hair center very soon.
I
All right. Thanks.
thank you a lot, really, for that. That was my first experience doing a podcast, but I think it was fun and it was really a nice conversation.
Thank you.